I think it's healthy that we're having these kind of conversations because says we're working together and learning from each other, but we also have schedules to keep, and I know people do have obligations in the afternoon that they're meeting. This is we're starting to wrap up a little bit, and so as we get into this last couple of sessions, we should be thinking about what are we going to take away from this meeting, what are we going to do differently when we go back to our work at home, and especially those in the CDRNs. How's this going to help you get your work done? This session is to try to draw us together on opportunities for CEO leaderships to make a difference. And the second part of this workshop is a one-day event where we hope and expect many CEOs will be present, and we're going to be fashioning the program based on this day and a half that we spent together. So where's Michael? Oh, there he is, right behind me. And I'm going to let Michael take over the moderator role and to introduce our panel. And I really thank all of the panelists for being present. This is, I think, one of the hardest parts of our workshop to begin to put the ideas together. Michael?
Well, thank you very much, Eric and Joe, and really, obviously, to all of you. There have been two purposes to this meeting, the general purpose and the specific purpose. The specific one is very important at this particular point in time, and that is as the CDRNs and PPRNs are ramping up to focus very specifically on the sustainability challenges and opportunities in that respect. And the general purpose is to focus on moving over the longer term to a continuous learning health system that is characterized by seamless interplay between care delivery and knowledge generation in every healthcare organization, not just those that are part of the CDRNs and PPRNs. Both are equally important to our conversations. One has more near-term priority than the other, but we need to keep our focus on both dimensions. The discussion over the last day and a half has really been extraordinary, and I know will continue to be extraordinary with the panel that we have up here today. We've covered a wide range of issues, and in order to set up the panel, I'm going to ask you to indulge me just for a couple of minutes as I, with a little interpretive license, try to tour us through some of the highlights and sound bites of the discussion over the last couple of days. Joe Selby started us off, and from him we heard that ultimately our research networks have to be self-sustaining. Eric Lawson emphasized the fact that this meeting is about making the case for getting on the bus. Uma Kodagal emphasized that CEOs and boards are receptive to the notion of a continuous learning health system, but they need some help. Mary Brainerd reminded us that prevailing patterns have she focused 80% of her time on processes and not on knowledge as a specific focus. Tom Garthwaite underscored the fact that knowledge generates pride. And from Ed Haverneck, we heard about the fact that a continuous learning culture can reduce cost. From Susan Wang, we heard about the importance of quality improvement and continuous learning joining forces. And in addition, she suggested in that respect that IRB processes can work, but it may take some gymnastics and special arrangements that we should be thinking creatively about. From Sarah Green, she noted that given the importance of moving to a learning health system, that watchful waiting is not an option. Tom Graff said we need to fail forward fast. Jim Rohak emphasized that a key governance focus is on shortening the cycle time. And we heard today from Peter Knox that we're focused on creating value at speed in many ways. Lou Sandy, picking up that theme, noted that the collective mission is earlier network and scaling our core learnings. Patrick Conway, I'm not sure Patrick actually said this, but I might as well ascribe it to him. The key challenge is how to reward broad system results and not service units. That reward system is obviously vital. Rita Redberg told us that the result of continuous learning culture is not only choosing wisely, but caring wisely. Brent James, among the many, many things he said, as is the case for everyone, reminded us that from his perspective, RCTs control out context. So we need to be mindful in that respect, but also continuous learning require data systems that are not currently developed for task. Karen DeSalvo noted that we need to raise the floor on patient access and involvement. Rachel Hess's question in many ways reminded us that networked learning brings the need for networked validation as well, which is also important to bear in mind. Jim Weinstein has told us that decisional regret is a common feature of choice deprivation. David Grossman, we heard practical knowledge generation matters to patients. From Sally Oken, in her creative equation for a sharing culture, reminded us of the importance of learning from you as a philosophy throughout the system. Nancy Cass told us that duties and respect go far beyond informed consent. There is an ethical duty to learn in what we do. From Peter Margolis, we heard that patients who participate do better, and effective learning health system leadership yields a fully shared mastery of the outcomes of the system. From John Steiner, that CDRN sustainability depends on success in sharing knowledge assets. From Trent Hayward, that the need to build a knowledge market that is free from knowledge hoarding is critical. And in the questions that we had, a couple of other questions today, we were reminded about some of the competitive issues at hand. That is the need to, from Rich Platt, and his question reminded us that in some circumstances, there are competitive research opportunities that have to be considered with respect to their impact on the notion of a continuous learning culture, whether it's from NIH or pharmaceutical companies, or these are issues that need to be explicitly considered. And from David Ballard, with his question, he reminded us that in a very competitive culture, the notion of a sharing culture has to encounter a reality test and be accommodated along the way. So these are the all issues, important challenges that we face. And now is our time with this panel to ratchet our focus in talking about the most important take-homes, literally take-homes in many ways, what we need to take home to our organizations to set the stage for the June CEO session, to make sure that it's as productive as possible in forging what someone mentioned as an all-in spirit. That is to say, a common leadership, purpose, and strategies for bringing practice and knowledge generation into that seamless alignment that we're talking about. We're going to focus on, this is a sample set of questions, that is for a closer sustained alignment of practice and research. What might be the core CEO appeal dimensions as we're talking with our colleagues at home? The key infrastructure elements that have to be borne in mind, the obstacles that need to be engaged. The most important step a CEO can take to enlist patients and families as active allies, as really centerpieces of the organizational philosophy and function. The strategy with the board, the tools that can be used, and the information that's important. What policy signals or actions are important to engaging from payers, purchasers, or research funders in order to help in the progress? What might be the measure of progress by the year 2020? We have a really extraordinarily talented panel to deal with these issues to prime the pump for the discussion. We are going to open it up and hope to have a room-wide set of conversations, but we've asked these folks to kick it off with their thoughts, and all are remarkably experienced and insightful. We have Ray Baxter, who is Senior Vice President for Community Benefit Research and Health Policy at Kaiser Permanente, David Labby, who is at Health Share of Oregon, a coordinated care organization of the major hospitals and health systems in Portland. He's the Chief Medical Officer there. We have Patricia Smith at the Alliance of Community Health Plans. She's the President and CEO. Janice Nevin, who's at Christiana Healthcare System in Delaware, where she's the Chief Medical Officer. And we have Russ Waitman, who is at the University of Kansas Medical Center, where he is Assistant Vice Chancellor for Enterprise Analytics and also the PI of the Greater Plains Collaborative, PCORNet CDRN. The full backgrounds, as with all of the participants, are in the background materials. In turning the floor over to Ray, I should underscore that we are operating by the Mary Brainerd rule, and that is our panel commenters are not obliged to answer the questions that have been posed. They should underscore the issues that they feel are most important for us to be mindful of as we move to the next stage of our activities. So, Ray, please take it over.